That was like the preview. Hi, guys. My name is Teresa Charlatan, nurse practitioner. I am one of the instructors here with Cape Scare. I'm so glad to be here with you. This is our second group, our second Zoom meeting. And I was going to introduce special congratulations to our graduates, our top students. Yay! All right. If anything, can we do a shout out, a handout? Who knows who these two individuals are?
We'll just say shout out to the people you know you're graduating.
We're gonna give you guys a round of applause. Everyone's on mute out of respect, but I feel it. I feel it, and the love is going to all these individuals. Okay, so now I'm going to give you from personal experience how I got here and how all my experience has allowed me to see the question and hear the question, and also go through all the rambunctious thoughts in your own brain. Right? Getting started. I will say, giving my history, saying that I started nursing school directly out of high school. That summer, I was doing my prereqs at Broward College. And because the waiting time to get into the nursing program was so long, 2 years as compared to 1 year waiting time at Kaiser University, I spent the extra money and I went to Kaiser University, as well as the passing time. The amount of time to complete it would be like 2 years as compared to 4 years, and all these things. So I was just really interested in getting it in, being able to get into the situation. I was just so excited, right? So when I got into class, I found my group of students, a group of friends, which is what you guys came into. We used to rent out Dunkin' Donuts or something for about like 6 hours just to study, and sometimes that wasn't even enough time. But that gave us a lot of great pointers, right? So let's just get started with first the facts, what we're dealing with, and then we'll be able to trickle into some cool tips and tricks of how to read your notes and how to prepare for the test. And then we'll do some practice questions, all right? Okay. So the first question is, the NCLEX. It stands for the National Council of Legislator Examination. Right? If we see it, if we understand it more, it might be less scary. There's two different ways of taking this test, and it's the AANP versus the ANCC. And sometimes there's even whole groups of people that are separated just because of the type of testing styles they're going to. But it's not even that serious, right? The biggest differences would be one would have lab values and one doesn't have lab values. We will come up with those differentiations in a second. So the AANP stands for the American Academy of Nursing Practitioners, and then the ANCC is the American Nurses. So the exam format is going to come in multiple ways. It's going to come in either the drag and drop, the multiple choice, SATA, and the point and click. Yes, there's most likely going to be pictures here, which is why I would like you to understand what you're seeing in every picture that you see, right? Because this is going to be a test of your knowledge base to be able to run free in a clinic or in a hospital to help everyone, right? It's a common knowledge base. So this is something so fun that I know you guys are going to know all these pictures. Of course, you guys know what the x-rays look like, right? So an example of SATA is select all that apply, which is one of the scariest sometimes because it could be all or it could be two, but then that's when we can start discussing the truth or false factor of it. All right. So a tip. Okay, so let's get to the questions. ANCC has 175 questions. ANCC has 175 questions, but only 150 of these are tested, right? So this is the one you should really be questioning about. But if anything, they're being sweet to you. They're doing this because 15 of these questions are harder than usual, but it's towards the beginning and it kind of gets your brain going, right? Like a warm up. So And then they don't even count. So if you get these individuals wrong, hallelujah, right? For the AANP, it's 150 questions and 135 that are actually tested for. Who knows if you can pros and cons this? Depends on how long you can sit for a test. It depends on how long your concentration goes. It depends on whether or not you can answer all these questions in that amount of time. But as well, I kind of liked more questions because that meant that the grade, if it was incorrect, was a little bit less, at least in my opinion. I don't even know. Okay, the hours. AANP is 3 hours. AANP is 3 hours. Wow, this one's 3.5. If there's any issues when it comes to reading, language barrier, limitations, feel free to go onto that website and fill out the paperwork, extra timing, and what would you need. And when it comes to the chances of passing, I realize that there may be a lot of states out here, which would be great to see a little shout out if you want to put your shout out on the chat. But there's Florida specifically is where I am. There's 4. When I Googled nationally, apparently, there's up to 8 at a specific state per year. But for Florida, you're going to have 3 opportunities. And then after that 3 opportunities, you're going to need to take a remedial course just to maybe highlight some things that you may be having a hard time on, because we don't want you to keep wasting your money for it. And then after that course, you can get back and try your 4th that year if you want to. Yeah. So the passing score for ANCC is 350, whereas the AANP, dyslexic mind. Dyslexic mind? Okay. So it would be these scores, don't even worry about it because you're not going to be the one doing this math anyways, right? Don't even worry about it. Just figure out which one you feel comfortable doing, whether or not you have to remember the labs, which you're going to have to remember the labs, all of them. It's just some of these questions, depending on which one you ask, which one you take, they're not going to put the lab values. They'll just assume that you understand what they are very hypoxic or something means. All right, so here's a few notes that I want to add for this before I erase it, and then we get into question tips. One, I already spoke about the accommodations. If you are late, right? Depending on if you, yes, you did. You spent like $300 or $400 on it. Yes, you had to spend money on it in order to make the reservation. So me, I'm a little bit late. I'm a late individual. That's why I had a motorcycle. I was the crazy motorcycle chick on the in my nursing school days, but I was still late. But hey, if you are late, even 5 minutes, you will not be allowed to take the exam. You might as well give yourself 20 minutes anyways, because when I parked, I literally prayed for like 10 minutes. So give yourself time, right? If you are late, they will not allow you to take the exam. If you have no ID, you might as well turn around. They will not allow you to take the exam. Yeah, it doesn't matter if you have mail that has your name on it. You need the ID. Might as well put it in your car the day before, put it in your pants the day before. Don't do that. I lost it one time that way. If you miss the appointment or if you cancel before or within the 48-hour gap that is required, you forfeit your fee. Even farther, you forfeit the fee. Okay, so to avoid scheduling yourself in a place that's going to get you late, like mad rush hour time or something like that, make sure you schedule in a time and day when you're normally not tired. For me, Mondays is my least favorite days, just like Garfield, right? I just assume, a lot of things are going to happen, so I'm prepared for the worst. So it wouldn't be a smart idea for like Monday to be the day that I'm going to go into here, with the impending doom feeling that I have. So, and then also 2 p.m. For some individuals like myself, 2 p.m. is like peak napping time, even 15 minutes just to restore my brain. I love it. I probably don't want to schedule the test right then and there. Maybe just before. I like morning taking tests, like right when I wake up, because the anxiety I'm brushing my teeth with anxiety. Well, might as well go with it, right? Roll with it like a thundering roar. Okay, so if everyone sees what's behind me, here are the differences, the different kind of questions. All right, and I'm mostly just going to give examples of multiple choice and SATA from what I have today. If you have some good examples, feel free to bring them up. All right, so since that was mostly it, I'm going to see if I can do this while sitting down. Just because I would rather have this discussion with everyone here. And then every once in a while, if it's something that I really feel like we need to take a note on, I'll put it behind us. So one of the first ones is anything that's before 10 months ago, you do not need to worry about covering it, right? There, when it comes to the kind of specialist to make these questions and the amount of review boards that it goes through, it's 10 months ago, it's not gonna, so don't even worry about it, right? Good muscle memory, right? When it comes to me, I have it somewhere. I should have brought it out. It would be really great. I have a good example. 1 second.
12 seconds later.
When I was in fifth grade, I had a teacher that allowed us to take a test, and it was a bit of an open book test. And in order for it to be open book, he gave us one little square card. And with this one little square card, whatever we can fit on this card is what we can have on the test. Right? 2 things I learned with this. 1, I can figure out how to write really small. I can write very tiny. 2, when you are writing notes, hoping this thing doesn't fall. When you are writing notes, really tiny, that type of focus creates a very specific memory in your brain, right? So in doing that, he was actually helping us learn in a better way. This teacher here. So he was allowing us to learn in a better way. But I took it even further because I'm terrified of, in my brain, I feel like I have a filing cabinet with all these different topics. So, you know, the SpongeBob, when they told him to forget everything but his name. And then like, he couldn't even remember, everything except for fry cooking. And they're like, oh, you're so amazing. What's your name? And he's like, name. How did we forget his name? That's how my memory works. So when I have a question that asks about this thing, and if I open up the filing cabinet and I can't find it, I go frozen. You'll see me short circuit. So this is what I did. If anything, minimally, I did that in the beginning of every every study day, and at the end of every study day, right? And you see this? So I did it for cranial nerves, endocrine system, and these are front and backs. See, yeah, endocrine, we can go all through them, right? This was my thing, right? I made it my bread and butter when I was focused on passing. It was one of those, I'm not watching TV unless I'm watching Grey's Anatomy. I'm not reading anything, or if I'm not eating, I'm on this thing and I'm doing it for like the next month, right? So muscle memory is what the topic of this one was. When you get the muscle memory, you write down the labs immediately when you start the test. Even while they're giving you these rules and stuff like that, the minute they leave you with this pen, I'm writing down PT, INR, you know, K, I'm writing these things down. I'm even making it into a rap into my brain, right? So beautiful. That's what I would definitely love to do. Oh, there's the note. If I could find my black marker. Oh, there it is. Would you guys prefer red or black? Thank you, Aina.
Black.
Black? Okay.
Yes.
So ANCC, one, I would say, ANCC not do, it does not list lab results. So get familiar with it because they're probably going to ask about it. right? Yeah. So that's one thing we would get in mind, depending on whether or not you like them or not. If you're confident, that was my thing. So I loved those questions. If you just give me a random number like, oh yeah, it seems like they have a cardiac issue. What is it? The potassium is above 3.5. I already knew. So that was another thing. I went really fast. If some individuals are like me, I can talk really fast. As you can see, my brain is even faster. So sometimes halfway through the halfway through the question, I'm like, potassium. And then the answer is actually, which one of these is contraindication, to the, and I'll get these things wrong. And then here I am sitting in the class with my professor going over these questions. And I'm like, I could have sworn that's what you're asking me. And they're like, I see where you're going, but that's not what, if you finished answering the question, you would have seen. So now we're getting to our next point. Get to know the Prego and Prego drugs. Get to know the Prego and Prego drugs. Don't get caught not knowing about them, because they are going to ask. And the way these questions, the way NCLEX works, correct me if I'm wrong. The way it works is they're going to ask you a question. If you get it right, good. If you get the answer right, good. It goes up. But if you get the answer wrong, it goes down. And then this is how they are figuring out your comprehension, right? And this in minimal ways, but also when it comes to the scoreboard. But then if you answer a question incorrect about Pregos, they're going to ask you another question just to give you another chance. Just to be like, maybe it was just a question. They'll ask you another Prego question. Maybe not immediately, but soon after, because they want to see. So then if not, they will continue on. If you answer the question right, then they're going to continue on. Okay, good. She knows. Okay, good. She knows. And then that's kind of how it goes sometimes. And that's why some individuals are able to answer up to 75 questions, and some individuals answer all the way to the 300. How much did I take? I got to 77, and I cried because I thought that I failed horribly. I took the test up to 75 questions, and then they gave me like a 5-minute test rest. So I got up, I did the hand scan just to get out, and then I went to the bathroom, and I was like, oh, how much time do I have? They're like, 5 minutes starting now. We wasted 15 seconds talking. Good luck. I was like, oh. And I just started running. I went to the bathroom, I calmed myself down, and I did a little prayer and everything. And I breathed in, any uncertainties, and I breathed out certainties and answers. You breathe in any of the strangers, and you're going to breathe out these answers, because this is where we're at here, right? It was becoming surreal for a moment. The next one is questions will be based on primary disorders. In public health or clinics or hospitals, don't expect you to be in some specialist office and you're going to see the rarest of, and we're going to be house. No, we're not going to be house today. We're going to be regular. We're going to, go with what is seen often, and we're going to assume exactly what they tell us and not add any more things, right? We're not going to be with the cane walking around. No, right? What is going to kill them first? I'm not sure if I'm able to say this, but I will say it. I will abbreviate it with WGTKF. Let's do this. I'm going to keep saying that. Kind of like what would Jesus do? Not to kill us, give us air. Oh, what's going to kill them first? WGTKF. You always ask that question. There were some easy questions like that for me. And I almost got kicked out because I was talking to myself. I was like, it turned into a video game to me. And they were like, you are in the ER and there are 4 patients. Which one of these are going to be admitted and which one's going to go home? And it was like, oh, one was on IV, vancomycin or something like that for a chronic infection that he did not take his medications for. Okay, so I think the question actually was the IV person, just to be sure, because I think that was a very, the margin of error, the safety margin was really delicate. So that one was the answer. It was other people that were easy, but I'm not going to try to do it from memory because I'm going to age myself. It was a while ago. So yes, we're going to assume WGKTF. The next one's going to be nail the culture questions. We want to nail the culture questions. We are all from different cultures, and we all understand that we have differences in beliefs, differences in things, and not to be racist if it's supposed to be a generalization to assist a culture. Okay, don't quote me. I'm not the dictionary, right? But this is what I'm saying loosely. If there's a question about a Jehovah's Witness and they're passed out or something like that, one thing you're not going to give them is like fresh frozen plasma or like blood. You're going to give them normal saline fluids because you're going to respect the wishes that literally the religion says Jehovah's Witness, and they do not take blood products. It gets really deep. It gets really ethical. Yes, let's not even talk about that, right? Or something like a Muslim person. If you know they already have the coverings and everything like that, let's be respectful. And if she's a woman, we're not going to have a male coming to touch her that we already know, right? These are the kind of situations and stuff. Let's not even get too deep into it, which you will have to get too deep into it. Let's find the topic in your books, right? We can go into deeper into another day, but please, let's get into this and understand them and always answer correctly. Next one is know the gold standard tests, right? I love gold standards. It's just the simple way, if I'm not sure, it's just a simple way of saying, this is the proven way of doing something. This is the way that it's always done. If you come into the hospital and say you cut your finger, what are they going to do? They're going to use soap, water, Neosporin addicts, and they're probably going to give you some pain. Gold standard, right? If you break your ankle, they're going to do what? The rest. They're going to raise the extremity. We're going to elevate it. We're going to put some ice and wrap it. Right. So is it rest or ice? So gold standards for that specific condition, right? What's the cheapest test usually? This is also assuming that so know the gold standard of that certain diagnosis of the treatment. Know the first and second antibiotic or medications for that. Let's say it's something for cardiac. You want to make sure that you know the first and the second for, for Caucasians, for Black individuals, which are different, right? Because we always start with calcium channel blockers as opposed to diuretics, right? Because we know this. So always know the gold standards and always assume it's the cheapest. If they come in saying that they have a respiratory issue or something like that, assume they're going to do a chest x-ray or something like that, just to be sure. The next one is going to be learn the assessments to treatment disorders. This one is my favorite. It's my favorite because I love a chance to get to test the person's body out, right? This is literally the opportunity you get to test the person's body out, push it beyond its limitations, not too far, but this is the way that you're testing them to see where the pain is coming from or what have you. If someone comes up to me and they say that they have a pain on their right shoulder, I know specifically that that has something to do with your gallbladder. Just something that we know, right? And I don't even have to poke and prod. Well, unless they're telling me something you have to do with like throwing a ball. If it's just a random pain right here and it comes and goes, and you're also, it's like fat, 40, female, and then you have a pain up here, gallbladder, right? So that's one. Here's another maneuver, the Finkelstein. Finkelstein, and then it's someone hold on to this for 30 seconds or more. It's the one for decurvain tenosynovitis. Decurvain tenosynovitis, right? I just love it because it's Finkelstein, and then the word is so difficult. I love difficult words, right? The next one's like the Lockman's maneuver, and then that's something that has to do with someone's knee to make sure they have, if they do or don't have an ACL injury in their knee, or the McMurrin sign, which is where you check to see if they have a meniscus injury. It's also a weird motion. The psoas extension, which is the one where you're going to pull someone's leg backwards, and that is where the appendix is tucked into the muscle fibers, and if you do that, the muscle is going to pull against the appendix, and that's going to cause pain specifically to the appendix if that is the cause. So those are some interesting, fun things that I have not been seeing being done in the hospital more often, but it would be really fun. They just like to poke them and prod them and look at the labs. But if you literally just come up to someone and go, boop, 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 like a cash register, it's going to tell you exactly what they have, right? Another one for acute appendicitis is the McBurney's point. That's the area that's literally right above the appendix. And they say the closer it gets to the appendix about to burst, you're going to be able to allocate, which you should already know. Rebound pain is like if you poke it, which if you already know you're in pain, you're over here beating on their stomach like a drum, I would be a little bit annoyed as a patient. Another one, meningitis, right? You have the Koenig's, which is the knee one. If you lift up their knee, they're going to want to do this to their neck, or the Brzezinski sign. If you do this to their neck, they're going to want to bring up their knee. And that's because the CNS, the spinal cord is so filled to the brink with bacteria as well as central fluid that you can't even bend your head. That's why they have the inability to do this if they had meningitis. Easy. How do you differentiate? Imagine you're like giving your bruh a hug and you're like, bruh, Brzezinski sign. And the knee, Koenig's, it just, the spelling is K-E-R, knee, Koenig's. We did the silliest things in order to remember these things, but you would want to know. The minute you say Koenig's, you're like, meningitis. Boom, next question, because we should only be spending about 60 seconds on these questions.
Teresa, can you repeat that, please?
Which one? The last few tests?
The signs that you just went over. My dog was barking. Yes. I didn't hear you.
Oh, yes. All right. So we have the Finkelstein. The Finkelstein is the de Quervain's tenosynovitis, right? The Lachman's maneuver, that's for the ACL of the knee, Lachman's, Lachmann, just in case. McMurray's sign, McMurray signs, that's the meniscus. McMurray's meniscus. The psoas extension, McBurney's point, and the Rovsing sign, all those three are for acute appendicitis. And the Koenig's, as well as the Brzezinski is for meningitis. Meningitis, Brzezinski, and Koenig's. Brzezinski and Koenig's. If you even see the picture, you'll see it's a kid laying on their back with either a knee or that. And another little hint for meningitis is they live somewhere with close conjugation of people. Colleges, prisons, nursing homes, you know, and then they have the inability to move their neck. And it's not because they went to a rave the other day, right?
Thank you.
So, you're welcome. All right, so that one are the tips of the NCLEX questions, right? Just about, right? We can get deeper into it, but now I want to talk about maximizing your score of a question, right? And then once we're able to maximize our score of a question, because we only have 60 seconds per question. They have 60 seconds per question. So we want to make sure we maximize our time. We don't get distracted, because I'm definitely that way. One of the main ways we're going to do this is by testing ourselves as often as we feel comfortable. The closer you get to the test, if you're like within 2 weeks, I would do a test like almost every day. So now we're going to talk about, where is it? Remember, even though for me it only took 75 questions, I was fully ready to be there for another 2 hours. So only give yourself 60 seconds per question. I'm not talking about have a timer right next to you, but have a timer far away, get all your electronics away, have yourself with these 60 questions in your book, making sure that the answer is not right in front of you. And then once you're done, you're able to look at the time and just try to rush yourself a little bit. That's the only way I can say it nicely. You have to make sure you know how you feel comfortable about it. None of this guessing, none of this whole conversation in the peanut gallery. First, the first answer that pops into your head is usually the correct answer. I'll say it again. the first question that pops into your head is usually the correct answer. The only reason why I say usually is because, you know, we have to finish reading the whole question. And once we read the whole question and we ruminate on it, the first answer that comes in is usually the answer. So the first answer that pops into your head is usually the correct answer. Use practice questions also as a way to understand your mind, as well as you're answering the questions. You're going to have time just like, oh, it could be A, it could be B. Find out which one's louder and find out which one's right. That's all I'm saying when it comes to inside your mind. And then find a way to quiet out the counter thoughts and the doubtful ones. An example would be when I take tests, especially I have a friend that when she's about to do a checkoff, she's Caucasian, so I could see her blush, like she starts to have an ascending, you know, flushed face. Me, I get so frazzled that I forget my own password, the password I've had all year. I forget the password. I lock myself out. I have to ask. Yeah, I'm the one always getting IT. So I always forget my passwords because I get so frazzled, which is why I'm just trying to remember the numbers for the labs. Don't even ask me for my student number, you know. But on the other hand, my other friend, she comes in and she sits a few seats away from her. It takes me 60 seconds to take a test, 15 minutes, and she's gone. 50 minutes or 60 minutes versus 15 minutes, and she's gone. She's waiting outside. She already got coffee. How do you feel, right? So, 2, if you are unable to choose a question, we're going to change the whole format of the question to truth or false, like we've done before, right? Let me see if I can give you a good example. So here's a question. The nurse is caring for a client who is visiting a spouse suddenly, and the spouse becomes confused and is noted of having aphasia, right? For now, I'm not going to tell you what aphasia is. What is the priority concern for this person? If you know what aphasia is, put it in the chat, right? For the people who know. The choices are A, sepsis, 2, B, stroke, C, delirium, or D, UTI. I start getting confused. Oh, well, is this an old person? Oh, blah, blah, blah. No, let's not start doing that, okay? So truth or false? Is someone that has sepsis going to become confused and have aphasia and not be able to, aphasia means swallow, not be able to swallow? No, sepsis, they might become confused. And that's correct. They might become confused, but not usually aphasia. Truth or false? Does stroke have to do with aphasia? Yes. Like Dora the Explorer. You know, does stroke have to do with aphasia? Yes. Delirium is truth or false? Delirium, yes, they're going to become confused, but they don't usually have aphasia, right? And then also same thing with UTI. Yes, that individual, if they are older, above 60, they will become confused, a change of mental status with the UTI, but this is not the situation that they told you. I could have definitely created a jungle when all they did was give me like a cat, right? So the answer is stroke. That's one way. If you are unable to understand a word or something like that, then just continue to plug it into as a sentence and see if it feels good. That's another good way of taking off questions, right? The other one is, let me see. Eliminate the wrong answers after reading the question options. Sometimes, if you feel comfortable, you read the answers and then you read the question, and then you'll be able to, the answers could fall off as you continue to read it. Or you can read everything afterwards, and with the questions, you'll be able to. But let's say the questions are long, like always tell the patient to do this and never sit the patient down, or before we stand them up, we always, something confusing like that, right? And they all seem similar. So what do? We're going to make sure we eliminate all the wrong answers. This is this one I definitely want you to know. If a question ever has any of these 5, you already know that's not the answer. All, no. None, every patient, no. Never, no. Right? This is, we can take that one off. And if you get that one wrong, you have my email, you have my number. You can come find me, right? And then these are the caution words that you can just look at strangely, but you know, if they're not totally toxic, maybe you can answer the question with that. But these are the ones that are like, I'll put a triangle. for caution. Why? Because the answer could be this stroke victim always has hemiplegia, which is right. You know, like, okay, that might be it. Or a stroke victim always have the symptoms of fast, which might not actually be. So be careful, right? Because if you come fast enough, all he has is, who knows, right? Exactly, often, sometimes, mostly. And if anything like that happens where we're having a hard time spending more than 60 seconds on a question, just use the mark button. Just like the questions that they have now, you can use a mark button and come back to it. Sometimes the tests that you have with classes, they don't allow you to come back just because they don't want you to lose your brain. They want you to be sure with the question. But when we actually do the NCLEX, you will be able to go back to the ones that you highlight, right? Which I usually would only go back afterwards if I have like 2-3 minutes left to lose my brain over something, right? The next one would be, don't get stuck, like I just said. Use the mark button to take the something off your shoulders. And you know what? Another thing that really did help me was one question would actually answer another question later on. Like, oh, this person with pernicious anemia and paresthesia. So I was like, yes. And I go back and I find that other question that says the symptom of pernicious anemia is, and then I get it. So sometimes that's a really good one. If you're unsure, you could put the mark button. Doesn't mean you have to come back. Just always answer the question. You'll never get a 0 for guessing. And hey, you have a 1 out of 4 chances of actually getting that guess right. Those are some good options for me. The next one is avoid choosing exotic diseases, right? We all love exotic things, but we can't say that they're good for this situation right now. Because like I said, this is like a general hospital. This is like a primary care clinic. So don't expect someone to come in with suddenly something sticking out of their shoulder, right? That there are questions like that, but that's for individuals that are taking a hospital exam, right? So avoid exotic diseases. Remember that there are primary care conditions, and don't add information, and keep it at face value, right? Like the question I just gave you before. Don't add, oh, what if he's old? What if he's a woman? What if da-da-da-da-da? Right? It could be BPH. I'm going to get another example. Right. So a pregnant client is having, remember I told you about the pregnant? It's going to come. A pregnant client is having a non-stress test, an NST. It is noted that the fetal heartbeat raises 20 beats per minute, lasting 20 seconds every time the fetus moves. The nurse explains that A, the test is inconclusive and should be repeated. B, further testing is needed. C, the test is normal and the fetus is reacting appropriately. Or D, the fetus is distressed. With my decade of knowledge, I can still say that I would be completely, at least 80% sure of this answer, right? Because I'm not a specialist. It's not going to be something that I'm going to be like 100% on. I would put a mark on this. And then hopefully later on, I'm going to have another question that has to do with something about a non-stress test. And in the question, they're going to answer that question. You know, that's what I would do. But the answer for this, just so I don't leave us on the cliff, is C. We're going to, the test is normal and the fetus is reacting appropriately. You would know this if you know the normal test values of all your tests, right? They're going to, that was what that was. It was knowledge based on tests and reading notes. And if you're not in a real situation, you don't do something like, I'll be right back. Let me find the doctor. You're going to give her a heart attack unnecessarily, right? So that's why it's really necessary to understand what all these things mean. Moving on to the next one. I'll just put that, no exotics, even though I love exotic. And if anyone still needs time to look at these, I'll get my head out of the way. So another note is take your bathroom breaks. Very serious for me, at least. I took my bathroom break. It was allowed me to reset. And if I did spend another hour, it would have felt like I just sat back down. And it doesn't get you too frazzled. breathing, exercising, positive talk, like we got this, and not, oh my effing goodness, you know, like we got this. You tested for this, you're ready for this, right? So